earlier on in the programme, we were talking about the problem of insomnia, and a lot of people have that problem, unfortunately. Increasing number of people have the problem of insomnia. And I was speaking to Sue Wilson, who's a sleep expert at the Imperial College London, and Sue was saying to us, look, instead of all these tablets being given out and all these Z, they all start with the word Z, apparently, all these tablets, these sleeping tablets, the new ones, let's give people counselling. Let's give people cognitive behavioural therapy. So what's that all about then? Will it help with insomnia? Emma-Jayne Williamson is from the Priory in Chelmsford and is a cognitive behavioural therapy therapist. Emma-Jayne, good morning.
Good morning.
What is CBT and can it help insomniacs?
Yes, it can help insomnia. I mean, there's many reasons for why people have trouble sleeping. They might include distress or physical discomfort or physical illness. And obviously our needs vary, from when we're a small child or a baby to when we're an adult. But often people start to experience problems because of difficulties in their life. And what cognitive behavioural therapy can do is start to look at the thought, feeling and behaviour connection that many people have. It can be quite difficult. People get into a vicious circle with their sleep. They start having some sleep problems and then they continue to worry about them, which in itself actually keeps them awake.
Yeah.
So what cognitive behavioural therapy aims to do is to actually cut the chain, to try and do something different. So there are various behavioural choices that we can put in. But before we do that, we actually need to find out, perhaps there's a reason for the problem. And one of the things that we can obviously do at the Priory is to give people an assessment and actually look at some of the background problems. We do a baseline assessment, find out what's actually going on for them, and then we'll establish a plan of care. So sort of changes that they might be looking at. So we'll look at relaxation techniques before people go to bed. You'll be looking at particular sleep patterns. So it's very much like getting back into a pattern as you would a small child. So you'd have what we call a sleep routine or sleep hygiene.
Right. And of course, they don't use sleep deprivation as a torture for nothing, do they? It's it's a very effective torture.
Yes, it is. It's pretty horrible when you've experienced it, and I think we've all experienced it from time to time.
Yeah.
It's when it becomes a chronic problem. The odd night here and there is not going to do anybody any harm. It's when it's persistent, when it's chronic, that's when we need to start doing something about it.
So how, if you're going through that, and I bet you there's people listening to us at the moment who are going through it at the moment.
Oh, I'm sure.
Yeah, and so they go to bed tonight, and they don't have any caffeine, and they don't, they don't have a heavy meal, they don't have any alcohol, and all this sort of thing, and they go to bed and they think, I'm not going to sleep tonight. I'm not going to sleep tonight. What do they do?
Okay, well, the first thing is having that thought in itself, I'm not going to sleep tonight, often can become a self-fulfilling prophecy. So actually, where's the evidence that they're not going to sleep just because you don't sleep?
Well, because they didn't last night, the night before, the night,
Yeah, but in a lifetime, how many nights have they slept and how many nights haven't they slept?
Right.
So one of the things we need to do is actually get a sleep diary. So we'll actually be looking at a pattern over a week or two, find out what helps, what doesn't help, why do they sleep well on some nights and sleep so poorly on another night? What is the problem? Is it that they're having difficulty getting off to sleep? Are they waking throughout the night or are they waking early? And some of those might be signs of other ill health problems that may be occurring. So it's important to establish what's going on in the first place.
Yeah.
But what we can help people do with CBT is actually challenge that initial thought, right, I have trouble sleeping. People will often describe themselves as having insomnia. I've always had this problem. But how true is that? And if we can establish that it is true, then we can start to look at things to make it more comfortable for them, to actually help them. And that doesn't always involve medication.
Right.
Sometimes it involves medication over a very, very short period of time, 2 or 3 weeks, just to start to get people back into a routine. But there are so many behavioural things that we can do. And one of the tips that I will often teach people is to actually write down some of their worries and some of their difficulties in a little journal or something like that, and actually, give themselves some self-talk. I'm going to write this problem down, and tomorrow I'm going to actually actively deal with it.
Doesn't it make it a sort of bigger deal for them then, Right.
The trouble is, Dave, if you try and ignore something, it tends to come back. Okay, it's very difficult to push something out of your mind.
Right.
If something's worrying you, it's going to come back.
Yeah.
So what we actually need to do is, recognise that
Face
it's there, monitor it,
Yeah.
and face it. Yeah. And invariably, there's something we can do about the worry. We can teach somebody how to manage their worry as well.
So you're effectively saying to me that insomnia can be cured?
Yes, it certainly can for the majority of patients. I wouldn't say, there are probably going to be the odd patients here and there that can't be cured, but I suspect that they're people that haven't actually been given the help that is available.
Emma-Jayne, thank you so much for coming on. Emma-Jayne Williamson there, looking at it from the clinical aspect, CBT therapist there at the Priory in Chelmsford.